Hey guys, and welcome back to Keep Moving Uncut. It's a station all about keeping you moving, healthy, strong, fit, pain-free, and it's uncut because we don't do any editing, so please forgive us if we make a few mistakes. I'm Dr. Tiffany Hunter, and I'm a doctor of physical therapy.
And I'm Kayla. I'm a physical therapist assistant. And today we are going to talk a little bit about ice and heat.
What's the difference?
Yes, what's the difference? And there are a lot of good questions on what's the difference between ice and heat and what we do. So we're going to start with ice. So ice is good for a lot of things, but we use ice a lot in physical therapy because it helps with healing. This is a gel ice pack that we use here in the clinic. So ice is good for healing, and it's also good for pain relief. A lot of times we'll use ice if we have a good fresh injury. So if I walk outside and I trip on the curb and my ankle is now swollen and it's red and it's hot, I'm gonna get this ice pack and I'm gonna use ice on that injury for about a week or two after that injury. So that's one of the great benefits of ice. It also just helps with pain. It helps healing. So you can use ice whenever you have an injury, period. Use your back, your hip, your knee, on the knee. And so we'll get that ice pack. We'll put it on for about 20 minutes and let that sit to really get the good healing factor in. But we can't just throw the ice pack on and put it directly on our skin. That is bad.
It's not very comfortable.
That is bad. You can really hurt yourself that way and mess up your skin.
Especially if you're using regular ice that's not a gel pack, or especially if you're using just a bag of ice.
Yes, it can be very harmful. So we want to make sure we put it in a pillowcase or a towel, and we'll just take it and kind of wrap it right around it and then put the ice on our body. And that allows for the proper application of the ice. And so if you don't have a gel pack at home, there's other ways. You can just get ice out of the freezer. You can put it in a Ziploc bag and you can do the exact same thing. Make sure you wrap it up in a towel and then put it on wherever you're feeling that pain or that soreness or that achiness. So that is the great thing about ice.
Don't be discouraged if you think I can't feel it throughout with the towel or that, because if you leave it in there long enough, then you're like, okay, now I can feel the coolness. So give it a few seconds, you'll feel it coming through, and it helps protect your skin.
It's in about 20 minutes. It doesn't need to go 30, 45. That can be excessive. So about 20 minutes is a good amount of time to leave ice on.
It really helps to reduce the swelling. If it's something that is a new injury, let's elevate it above the heart. That's going to help out. So if it's your arm, you're going to raise it up. If it's your leg, you're lying down, you're going to prop your leg up, or your ankle.
Yes, it's very, very good for healing and pain relief. So we move on to heat. Heat is the good stuff that everybody loves because it feels good.
It's great.
It has a lot of precautions with it though. So this is a gel pack that's cold right now, but it can also be used as a hot pack. So you can take something like this, put it in the microwave for about 45 seconds, and it will start to be hot at that point. So same deal with something like this though. You really have to wrap it up in something before you put it on your shoulder, your back, your knee, to prevent burns. Because although you might think, oh, it's not too hot, you never want to put it directly on your skin.
Don't want to fall asleep either, because a lot of times when you think it's not too hot, I'm comfortable, especially when you've been hurting and you start to relax with the moist heat or the warmth, and then all of a sudden you fall asleep and you realize that you might have a skin burn.
Yeah.
So you don't want to fall asleep with it on. You want to try to stay awake and definitely protect your skin. Don't put it directly on.
Yes, and so heat is good for pain relief, for increasing the flexibility or the mobility of your muscles, your tendons, your ligaments, your joints. And also just, it can be soothing. So if you're just in a lot of pain and you struggle to find comfort, this is something that can help you get comfortable at a good temperature. And always, no matter what, if you're using ice, if you're using heat, you want to check the skin after application. So whenever you use your 20 minutes or about 10 to 20 minutes with the hot pack, you always want to take it off, check your skin, make sure it's no bumps, no blisters. There's going to be a little redness. That's normal, but it shouldn't be just bloody red.
It should go away too. So if it's red for a while, it's normal, but if it's been an hour later, it's a concern.
Yes. So these are the good benefits of heat and ice. They're both great. You can use both
Excellent.
in a day. It's okay if you use heat first and then use ice after. That's okay. If you have a preference, that's okay too. Not everything's for everybody, so try it out, see what you love. But they're both really, really good for your body.
There. All right. Thank